So what I'm going to be talking about today is a little bit about the law that exists currently in Massachusetts, and then a lot more about the regulations for schools from the Department of Public Health. You can go to the next slide. So this is sort of how I'm going to talk about it, a bit about the history of the law, an overview of the regulations, what we've done to implement both the law and the regulations, some of our resources, and then some of the challenges, which I would also love to hear from folks in the audience about challenges and successes of implementing the regulations, as well as your questions. Please interrupt me at any point, because this can then be more of a conversation, which I'm happy to do. And I'm wondering if what you were hoping you would hear is going to be covered by this list, or if there's something else you want to make sure that we talk about.
What is actually required by law per school? Okay.
I hope.
And at what grade level and age is it required?
I'll be.
We can do as much as we want, but what's required, like to kind of cover everything.
Great. So what's required by both the law and the regulations, I'll definitely be going over that again. If I'm not going into enough detail, ask me questions and we will go into even more detail. Okay, so we can go to the next. So people probably already know this. In 2010, that's when the statute passed in this state. We were the 7th state in the country to pass what have become, they've really come to be known as return to play laws. As Dr. Cantu spoke about earlier today, all 50 states and DC actually now have sports concussion law, return to play laws on the books. These, you can, I think, go to the next slide. These have really come about because of particularly horrible cases where student athletes have been very injured by concussion, often by second impact syndrome, which we can talk a little bit about, and as well as the increasing recognition of concussion as a lifetime health issue. And so that has really changed. It's really beginning to change culture and therefore policy around concussion. The components of the law itself are that it required the Department of Public Health, DPH stands for Department of Public Health. We use acronyms a lot in public health. It required DPH to create, or at least identify, an annual training program that, and there were several stakeholder groups identified in the law that the training program was required for. Those included athletic directors, coaches, trainers, parents, and students. It also had this removal from play provision, which is that if a student athlete is suspected of having a concussion, not diagnosed, suspected of having a concussion, they must be removed from play, and they cannot be returned to play until there is clearance by a licensed health professional. They also, again, under the law, cannot be returned to play that day. Okay? The law also requires that students disclose a history of head injury at the start of each season, each sports season. Okay, at the start of each sports season, requires record keeping. It allowed schools or the department to establish penalties for violating the law, and it required the department to develop regulations. So, next slide. We very quickly, after the passage of the law, the department, the law, by the way, went into effect with what was called an emergency preamble, so it was effective immediately. There wasn't even 90 days. You had to come into compliance with the law immediately. So the department at that time issued FAQ, frequently asked questions, to help schools understand what the meaning of the law would be, because the regulatory process takes time, and it wasn't until June of 2011 that we were able to go through the entire regulatory process, which is developing the regulations, holding public hearings, getting more than 200 written responses to the draft regulations, redrafting them, and then promulgating them. That didn't happen until 2011. We also spent time developing a lot of guidance documents and forms and resources that I'm going to be talking more about towards the end of the presentation. We identified free online trainings, which I will talk about more, as well as criteria and an approval process for in-person trainings. We issued a clinical advisory to pediatricians about their responsibilities under the law and under the regulations, and we have ongoing communication with schools, and I'm going to talk a little bit more about that. So let's talk about the regulation, because really right now, this is what I'm going to be going over are what schools are responsible to comply with, okay? So first of all, the first question, it applies to all public middle and high schools, all of them, okay? All public middle and high schools. We define that as grades 6 through 12. It also applies to all other schools, private or parochial, that are members of the Massachusetts Interscholastic Athletic Association. It applies to all extracurricular interscholastic sports. So some middle schools may not actually have interscholastic athletics. Some do and some don't. And in those cases, if they do not, the regulations don't apply to them because they apply to interscholastic athletics. That's taken from the law. That's why the regulations apply to interscholastic athletics. The other thing is they don't apply to Little League or Pop Warner or other club sports and communities. Now, two really important points about that. The first is that when we developed the regulation, there was a decision by our legal counsel that the way the law had passed and the language in the law, it really did limit us to creating regulation for schools, for public schools and schools that were MIAA members. So we were constrained and to that group of schools. This does not mean that town or club sports can't comply with the regulation. That would be a great thing, and there are lots of reasons to do that. You heard the folks from Brookline talking, if you were here at the beginning of the day, talking about how she's very interested in complying with the regulation. So we're very happy to work with towns and with club sports, provide guidance documents, but it's not a requirement of the regulation or of the law. Okay. Yes?
So I coordinate a middle school program that's interscholastic, but it's run through like community education in the town. Are they?
That would fall under the regulations. Yep. Thanks. So the question was, I don't know if everybody could hear it, if you a middle school with an interscholastic program connected and run through the town, that would be you would be required to comply with the regulation. So now we'll talk about what's in that regulation. They really stress a team approach. So as you're hearing all of the components of the regulation, keep that in mind. It's really about a team approach to exist in the school to think about and protect the health and safety of student athletes. The major components of the regulation are that schools have to have policies. So that there have to be formal policies regarding the prevention and management of sports concussion. And I'm going to run through what those policies need to include. There's a lot in the regulation about the requirement for annual training. Now, this is the annual training for students, parents, medical, and athletic staff. It states very clearly in the law that the training needs to be annual. So again, the department was paralleling in its regulation the requirement of the law that this training be annual, and it is mandatory. So for example, parents and students have to take the training annually, and the school has to have a documentation process in their policy for knowing that each student athlete and a parent or caregiver has taken that, as well as the coaches, as well as the medical staff, so the school nurses, the school physician, and all of the athletic staff, the athletic trainers, the athletic director, any volunteers that are associated with the sports program. And again, there have to be, in the policy, it needs to say how that's going to be documented, whether it's a sign-in sheet, whether it's the online trainings that are approved. After you take them, it will print out a certificate. Some schools require that every parent turns in their certificate that says they took, so different schools have different ways of documenting it, but schools have to have in their policy a way of documenting that annual training. There are additional pre-participation requirements for student athletes and their parents. Not only do they have to take this annual training, at the start of every sports season, not at the beginning of the year, but at the start of every sports season, again, this parallels the law, they need to complete a pre-participation form. And I'm going to talk more about that in a minute, but the pre-participation form basically documents a history of head injury. This is the mechanism by which coaches, the school nurse, and other people who are part of the team of assuring students' health and safety know whether there's a history of concussion and whether this student might be at additional risk for future concussion. The policies also must cover exclusion from play after a head injury. I'm going to go into all of these in more detail. Medical clearance and return to play. That's where we're probably going to spend a lot of time because that's where there are often a lot of questions. And then there are requirements for data reporting. So, next slide. Next slide. There. So I've talked about most of this, all school districts, this is what has to be in their policies. I will just say, I talked about the annual training, the pre-participation forms, talked about those a little bit, and I will more. There also needs to be in the policies a process for medical or nursing review of the pre-participation forms so that if there's one that comes in where the student is disclosing a history of head injury, that the nurse is aware of that or the school physician is aware of that. There are also, as part of the forms that are required, there are report of head injury during the sports season forms, which I'll talk more about, but there needs to be, those also have to have nursing and medical review. There needs to be in the policies clear procedures for removing students from play and referring for medical evaluation. I'm going to talk more about all of this. Graduated reentry medical clearance, and this. The final bead up here, which I don't know if everybody can see back there, but it says requirements for coaches, certified athletic trainers, and volunteers to teach strategies that minimize sports-related head injury and minimize dangerous play. When the department included this in the regulation in 2011, this was novel in the country. There were no other regulations or laws that required coaches and other responsible parties to teach practice standards and to teach play standards that would reduce the likelihood of head injury. This, for those of you who were in this room for the last session, this continues to be a leading edge, moving edge in the field about what we know about what can prevent or at least minimize the likelihood of sports-related injury. And we're at the department continuing to try to think about ways to provide schools and coaches with some guidance around how to do that effectively. So this is a really important part of the regulations that we hope, as we learn more about concussion over time, will be even more substantive. So the annual training, I've talked about this already a little bit. Coaches, certified athletic trainers, other kinds of trainers, volunteers, the school and team physicians, nurses, athletic directors, my favorite, marching band directors. That's actually in the law. We didn't make that up. I will say that's one of the only pieces of the law that when we put it into the regulation, we were like, why are we doing that? There is actually a story that goes with that. The legislator who put that in there had apparently had a child who was literally injured in marching band, got a concussion with a brass instrument that hit them in the head during a practice, and wanted to make certain the band directors got annual training around concussion, parents and student athletes. The 2 free online trainings that we've identified are the CDC's Heads Up Concussion. That is an excellent online training. It takes about 20 minutes. It is not burdensome. And the other is the National Federation of High Schools, also a quality training. Again, it's only about 20 minutes. Sometime when you go into the NFHS website, you might think that you have to sign up and pay, but because that's what pops up originally, but there's actually a button for taking this training that they allow you to do free of charge. Both print out a certificate, so it's a nice way for schools to make sure that everybody is actually getting the training. We have also identified in-person trainings that we've reviewed the learning objectives and the agenda and the curriculum at the Department of Public Health, and those approved in-person trainings are available on our website, which I'll give you at the end of the presentation. So the pre-participation requirements for students and parents, I've talked about all of the pre-participation, the annual training and the pre-participation form, which is the documentation of history of head injury before each sports season. I'll probably say that another couple of times. There are also ongoing requirements, and the most basic of these is that if the student athlete has a head injury during the sports season, they need to complete a report of head injury form. That includes whether the head injury occurred during interscholastic athletics, whatever team sport they play for the school, or outside of the school. So in those cases, it's the parent's responsibility to complete that form. So if on the weekend, a football player is riding a bike and gets a head injury, that needs to be reported, because that head injury is as much of a health and safety risk to that football player as a concussion sustained during football would be. Question, yes.
On the pre-participation and the documentation, do you have forms online?
I do, and I will give you the website for them before it's over. And there are also copies downstairs on the DPH, the Department of Public Health has a table on the floor below this, and there are copies of them just so you can take a look at them. I will say in the regulation, what we require is that you either use the DPH form or a school-based equivalent. And basically, so they're available in a Word document. You can cut and paste all of the content and put it on the school's letterhead. A lot of schools choose to do that for obvious reasons. But a school-based equivalent is defined in the regulations as having to include all of the variables that are included on the Department of Public Health form.
Are those forms, the report of head injury form, are those turned into you? Or
No? That's a great question. That is a great question. So the question is, what happens to those report of head injury forms? They are turned in to whoever is named in the policy. It's usually the coach or athletic director, and there has to be a policy for how they're going to be shared with medical staff, either nursing or the school physician, for review, so that both of those folks need to be in the loop, that there's a concussion history or a concussion happened during the sports season, and they should only be shared outside of those parties on a need-to-know basis. So sometimes that's going to be a teacher who may need to know because of academic accommodations, but they really should be, once they're shared with the coach or athletic director and the nurse or whoever's doing that medical evaluation, after that, only on a need-to-know basis. The Department of Public Health does not collect those forms, even for surveillance. We do, and I will talk about this, require data submission in the aggregate at the end of the school year, and I'll talk about that in a minute, but we don't get the forms themselves. We're very conscious of confidentiality, so we're not interested in getting the names of students, yes. Exclusion from play. Thank you for making me hurry up. So students who sustain a head injury or a suspected concussion must be pulled from play And again, I've said this, but this part very much bears repeating. They may not be returned to play that day. This means sideline evaluation about whether it's a concussion or not is not permitted under these regulations. There is lots of evidence that sideline diagnosis of concussion is not effective, so it's not permitted under the regulation. They have to see a medical provider, and they're not allowed to be returned to play that day. If it occurs during play or practice, the parents must be promptly notified, and medical clearance must be provided before a student can return to play. Medical clearance has a very specific definition under our regulation. I'm going to talk about that in just a minute. So each student who's removed from play and diagnosed with a concussion, so let's give an example. You have a student who has a suspected head injury in a soccer game. You know, they went up for a head or two head collisions, both players were pulled. They can't be returned that day. The student goes on, from your school, goes to their primary care provider, and the person says, you actually don't have a concussion. They can return to play. The physician says you do have a concussion, then a graduated reentry plan has to be developed. Okay? Graduated reentry plans, again under our regulation, and this was novel at the time but has now come to be understood as really standard practice, is graduated reentry to both academics, so schoolwork, and graduated reentry to athletics. It's got to include both. And the plans themselves should be developed by a team that involves the teachers, guidance counselor, school nurse, a certified athletic trainer if your school has one, the parent, the student's primary care provider, or whoever's managing their concussion, because in some cases other experts, clinical experts are brought in. So that whole team should be involved in the graduated reentry plan. Can you go to the next slide?
Realistically, how do you expect that to happen? I mean, I work now in the schools, but I come from the primary care setting, and I spoke a little bit earlier, but so you've taken all this time, you're doing your eval, the concussion, and then in the office, they've been sent in to be evaluated, and you've diagnosed a concussion, you've filled out your ACE care plan, you've done your graduate reentry plan, and now you send it with the parent. I mean, realistically, I'm always, 45 minutes behind in practice as it is. So realistically, how do I, as the primary care provider, be part of that team?
Well, you've actually, in the scenario that you're talking about, you actually have participated in the team by providing them the information that they need to make the graduated reentry plan. But you're not done yet, and we'll get to that in medical clearance. There's more, though. You're not done yet. So she's a primary care provider and giving the information to the rest of the team about the recommendations for the graduated reentry plan, and that's participation. So these plans need to include physical and cognitive rest. So does that make sense? This is not just, it's not simply physical rest, it's also cognitive rest. That, no screen time, no driving for older kids. That takes a lot of cognition. So no reading, it's hard for those first couple of days when you need complete physical and cognitive rest. No texting, no computer time, no games. Those, in fact, there are some studies about the screen time being particularly bad for recovery. So really reducing screen time is incredibly important and incredibly hard. Like, let's face it, that could be harder than not getting to play. And then graduated return to athletic activities and classroom studies. So we'll talk about that in a minute more. The graduated reentry plan should include estimated time intervals. So what that's referring to is at what point the estimation is when the person could resume coming back to low levels of both cognitive activity, reading, for example, and low levels of physical activity, walking, stretching, that kind of thing. And then what the plan is for resuming the next level of activity. Frequency of assessments by the medical provider, and a plan for communication and coordination. Probably every speaker you're going to hear today is going to talk about the importance of communication, and that's no less true in our regulations. It is only after graduated reentry is completed, and that includes that at each step of the reentry plan, which particularly to sports, that you are symptom-free. So you're symptom-free at rest, then you're symptom-free at low levels of physical activity. Then you begin to add weights and you continue to be symptom-free for 24 hours. Then you do practice drills and you're symptom-free. And then you do full practice and you're symptom-free. Then you get medical clearance, okay? And only then do you get medical clearance to return to play. Currently in our regulations, there are 4 categories of clinicians that can provide medical clearance: physicians, nurse practitioners, certified athletic trainers, CATs, and neuropsychologists. There is a medical clearance form. Not a doctor's note, Jimmy can go back to football in 7 days. That is not medical clearance. That's not medical clearance. Medical clearance has to be on the DPH form or the school-based equivalent. Again, those are on our website. And clinicians who are providing medical clearance, there's a spot on the form that says, I have actually had training in concussion assessment and management. Because not everyone who is a physician or an NP has had that training. So as part of their licensure. Certified athletic trainers and neuropsychologists have, but nurses and NPs may not have, so they have to certify that they've actually had appropriate training in concussion assessment and management. Yes?
In terms of the law, let's say 2 out of those 4 people disagree.
Such a good question. So the question is, what if you've got 2 clinicians that actually disagree about whether somebody's ready to return to play? So the first thing I always say, I get this question a lot. The first thing I always say is, there is no right to play in Massachusetts, right? There is no right to play. So this is the school's decision. And the school should put into their policies how they're going to negotiate clinical disagreements, whether they're going to take the cautious and conservative approach, because this is the brain of a child that we're talking about, and say, I'm going with the person who doesn't feel they're ready, or whether they're going to have some other approach. And the hierarchy of clinical degrees is a very, very touchy subject amongst clinicians. But there needs to be some thought about how you're going to handle that in advance, and it's really good to put that into your policies. I've had some schools that have done what I think is a really creative thing. So they have some physicians in the community that refuse to use the medical clearance form. Not sure why, but anyway. So they've gotten doctor's notes, and they use that as permission to begin graduated reentry. And then they use their certified athletic trainer to make the determination for medical clearance after the person has completed the graduated reentry. So there are, because they wanted to keep peace in their community. They didn't want physicians being angry at them for not taking them seriously with this note that they were getting, but they also wanted to follow the regulations. So there are creative ways of doing that. You need to think about that a little bit in advance. Okay, next slide. So just to point out the elements of medical clearance. On these forms, it notes the date and the nature of the injury, the symptoms, because that's one of the big pieces, and how long the symptoms lasted. It gives check boxes, so the clinicians don't have to spend lots of time. It gives check boxes. They like those. Whether there was a prior concussion, the final diagnosis of whether it was concussion or not, because that's really, if there was no concussion, then the medical clearance, it can happen right away and doesn't require the graduated reentry plan. And then the date that the graduated reentry plan was completed, so that everybody knows, that the clinician knows that there was actually a graduated reentry plan and it was completed. Okay, next slide. So schools. What are you required to report to the Department of Public Health? It really isn't a lot. I will say when this law passed, and you all know this, and trust me, Linda and I know this. Linda Brown, who is our sports concussion coordinator, is here with me today. And we are both very aware that when the law passed, it came with no money. So it was an unfunded mandate for everybody, right? So we were really conscious of this when we were developing the regulations and listened a lot to feedback. Our original draft of the regulations was more burdensome to schools than our current regulations are, and we got a lot of very constructive, if slightly angry, feedback on how to maintain the safety pieces of the regulation, but make sure that they weren't completely overburdening schools. Like, I literally think at one point we were requiring people to make 5 or 6 copies of every form and give them out to people. So we got really helpful feedback, and that's not in the regulation at all anymore. But the reporting requirements to the department are really very minimal. There's 2 things that you have to report. One is the total number of those report of head injury forms that you got in a year. That's one number. The other number is the total number of those forms that occurred during interscholastic athletics, right? Because remember I said that these forms have to be completed whether the injury took place in a, on a ski hill or that wasn't associated with school, or a bike ride, as well as anything that took place on the school field. So those are the 2 numbers. And they're due to DPH by August 30th after the school year is completed. So you only have to report once a year. Each school, not school district, but each school has to report only those 2 numbers. Now, if you want to, we have additional information that is optional that we ask schools to complete, because it really does help us sort of monitor what's happening out there. One of the questions is, how many students are in your school? So that we have a sense of, you got this many concussions out of how many kids? Another question that's optional is telling us whether your policies require, because this we left up to the schools, that all students provide report of head injury forms or only student athletes. Because some schools have decided that concussion is such an important issue that they want to know about every student concussion and not just those for athletes. So school policies differ on that, and we left that to the decision of the school, but it helps us to know whether we're looking at report of head injury forms that are just from athletes or from every student, right? To get a sense again of about frequency. What else is an optional, Linda? Those are the things that are right. And how many medical clearance, that's an optional question. We would love to know how many medical clearance forms you're getting in a year. Now remember, that shouldn't be a 1-to-1, right? The number of report of head injury forms might not be the same as the number of medical clearance forms. So we're not looking for a match there of numbers, because if the head injury occurred, at the end of May, you're probably not going to get a medical clearance form before school gets out. Or if your policy is to have all students, not just student athletes, complete them, you might never get a medical clearance form, because that's only for returning to athletics. So there are lots of reasons those numbers wouldn't match, but if you are willing to share that with us, it's really useful to us to get a sense of what's happening out there in the world with these regulations. So, if you don't remember anything else I say today, this is the most important thing. This is the DPH website, where there's just a plethora of resources. And it's a simple one. We actually got a friendly URL. That took us a year. It did. www.mass.gov/DPH /sports concussion, all one word. On that website are the required forms, so the pre-participation, report of head injury, and medical clearance forms are all there. You can find a copy of the regulations themselves, a list of the approved annual trainings that I talked about. There are also a list of approved clinical training. So if there are any clinicians out there that aren't sure that they've had the appropriate training that gets them to certified medical clearance, all they have to do is look on that list and get themselves trained. And then this is our favorite document. It's called Headstrong. And I think the next slide shows a picture of it. Yeah, Headstrong. This is for schools. This is guidance about how to develop a school policy and what meets the requirements of the regulations. We love this document. It's pretty, but we also love it because, we love pretty, but we also love it because it really does put the meat on the bones of these regulations. The regulations are regulatory. They're written by lawyers, very good and well-meaning lawyers, but lawyers that talk like lawyers. And so it's not always crystal clear to people who were not legally trained. The Headstrong policy guidance is meant to, it's all in everyday English and should be very helpful. We are also looking at revising the guidance, because one of the things we did was take some really, really good parts of school policies and put them in here, so examples from your peers, and we learn more about that every day. So we'll, as we look to update these, we'll be stealing more and more from your policies. We usually call and ask before we actually put you out there like that.
Is there
Question?
any school policy out there that you really, really would recommend that you like cut and paste that?
Well, these in this document, you will find pieces that you can literally cut and paste. So please make use of this. And also, I should have put Linda's contact information, and I will give you her contact information. Because Linda Brown, again, who's here with me, is our resident expert and a great person to call if you have questions. And if it's something we haven't thought about, then we figure it out. We talk about it and figure it out, either ask a lawyer or ask a school nurse or ask a member of our clinical advisory group, and we get you an answer. So we're also happy to provide individual technical assistance. Sorry, Linda. Can you go to the next slide? And I'm actually going to read out your phone number before it's over. This is just a long list of stuff that we have recently done. I'm not going to read it all, but I wanted to let you know that we are actually right now reviewing the regulations for some minor updates, so stay tuned to that. It's not going to be anything radical. We're not going to it's not going to be anything wholly different, but we are taking a look. For example, in our regulation right now, we think at least our language about when medical clearance occurs, we have one place where we think we confused matters, and it's hard to tell if we meant that should happen before graduated reentry or after. So we know we want to clarify that language as an example. So we're looking at that right now. We are right now reviewing a random sample of school policies, not to identify not to call people out, but to really help us think about where schools need technical assistance so that we can provide training and technical assistance and make policies stronger. Linda has an e-list that she sends out to schools periodically as reminders for sending in data, as reminders that we need confirmation that you have policies in place. And so we will probably be using that as a tool also to say, we've noticed that some school policies are not so strong in this area, so here's some guidance about that. Or we've noticed that every policy we have looked at is great. Congratulations, y'all are in this area are great. So we are taking a look at that, and we are looking at compiling the data reports that we get. You probably all know this is a very hot topic with the news. We get frequent requests beginning the 1st of August, sometimes in July, about how many schools have already sent us their data. We remind them that it's not due till the end of the month, but this is something that the press is very interested in, so we try to keep on top of so that we can reply when they ask us how many schools have actually sent in their data. And on that score, next slide, go to the next slide because it's a happier one. I'll go back to challenges. On that score, between the first year of data reporting and the second year of data reporting, we had a 250% increase in the number of schools that were actually complying with data reporting. I think a lot of schools just didn't know they were supposed to do it the first year. So we expect that to increase again and get even more schools providing the data that we need. And that's sort of a bellwether for whether concussion whether there really is compliance, not just with our data reporting, because that's not the most important piece, but with the policies and the regulations in general. So we are getting a sense that students are actually getting access to the concussion awareness, the concussion treatment and management that they need to make themselves, to be safer. And that graduated reentry plans are being completed successfully. We're learning much more about that. So go back to the challenges for a second. I just want to acknowledge, and then I will stop, that implementation on this stuff is really challenging. I know that. Again, none of you got money to do this. And school nurses are telling us that they're seeing much larger numbers of concussions than were anticipated. Awareness brings diagnosis. So this is something that we're seeing even larger numbers. It's hard to both review and maintain the forms when there are that many of them coming in. So it's taxing on the nursing and the athletic staff. The other thing is, and you may be experiencing this, not all clinicians are aware of their responsibilities under the law. So again, that resistance to using the medical clearance form is sometimes there. We are trying to do more about that with the Massachusetts Medical Society, but there's still a lot of word to get out there with clinicians, I think. So I put up here another challenge is that our communication needs to be more thorough. Linda recently learned that not all assistant athletic directors are on the listserv, or even athletic directors. And so we need to make sure we're actually getting the information to the right people. We have not been perfect in this. We're trying. And it's absolutely clear that more education is needed for parents. We are still experiencing, and I'm sure you are, parents who are like, my kid has got to get back into that game. What is this medical clearance and graduated reentry? The game is on Saturday. Today is Friday. There is no time for that graduated reentry thing. So, more and more education and this culture shift that I think is happening. Oh, and I would say, I think I also have to say that teachers, I see a nod. Teachers also need some additional awareness because they're not always understanding the importance of cognitive rest, and so they're sometimes resistant to the graduated reentry plan, which might include days out of school, it might include no test taking or half days, reduced homework assignments and that kind of thing, and that has been a problem in some schools. So we know that there are challenges that are still out there, but there's a movement afoot, and things are really changing, we think, for the best. And I think that's the end of my slides. Yeah. So.
Just one quick
Sure.
thought on as far as supporting our role in informing teachers to keep them aware of that. Is sometimes these kids will need what we call a 504 plan,
Right.
in place, and that usually will help teachers
Right.
accommodating our students better.
Right, I think that's true. So in the the cases where the concussion is taking a longer time to heal, there's sometimes a need for a 504 plan, a special education plan, and that does certainly bring teachers into the awareness.
So the state is requiring us to educate the parents, educate our trainers, our nurses, our coaches, and our students. But the state is not by impact testing
Correct.
on all the children.
That is absolutely the
As a
case.
parent's decision. Am I
Yes.
correct?
Yes. So impact testing, which is one form of cognitive testing of participation cognitive testing, is not required under our regulations. We have a very top quality clinical advisory. Some of the presenters here today are on that advisory. They have given of their time very generously to the department to help us think through some of these things. And we are still getting the advice that cognitive testing should not be mandatory. So it is not part of our regulation. There are a lot of questions with it that much longer topic of conversation, but they're not mandated by our regulation.
I had gone onto that CDC website,
Mhm.
and I'm in West Bridgewater, and every parent who has a kid who is playing has to, fill out the form, and that's a really good website, and I think parents are getting educated because of that website.
I completely agree. The CDC, so the Centers for Disease Control and Prevention, have really taken up the issue of sports concussion. They led the country even before Massachusetts. I mean, we were only the 7th state, and they were ahead of us. They were providing us materials before we even had legislation. And the website, the CDC website, it's called the Heads Up Concussion website, is excellent. It has handouts for parents who have limited English proficiency. There are materials in other languages, and they're developing more. If you have need, by the way, for particular language groups, it would be helpful for us to know that. We're trying to think about how to provide some support around that. So if you all want to tell us some language groups, we'd be open to that. So the CDC's website is just a great place. If you haven't already checked it out, I agree. It's a great website.
Hopefully you'll have guide me in the right direction. My big obstacle is graduated return to play protocols and athletic trainer. Athletes injured in, say, the fall.
Yep.
They're not going to play a sport until the spring. They have not completed their season because they're still symptomatic, but we can't chase them all winter long.
Yep.
And now they're playing independently outside of school, and they come back in the spring and they sign up for a sport and they say, well, I've been playing all winter. Now, we're still expected to complete the graduated return to play protocol by law.
Mm-hmm.
How do I justify that to a parent, a coach, a physician? It's, you're in this.
Blame DPH.
Yes. We'll take the fall. It's a good.
I do. Because I say, it's not my law, it's the
Right.
state law.
Exactly.
And this is what's required of us.
Right.
But you're really, I mean, it's kind of futile. I mean, a kid's been asymptomatic for 2 months. They've been playing independently.
The thing is, so all I would say about that could everybody hear that? The kid's been asymptomatic. He's played outside of school. The only thing I would say to that is you don't know that kid's been asymptomatic.
Right.
So it's for liability reasons, for the child's safety reasons, it's our responsibility to actually know that and not just hear that as a report. So that would be, in addition to blaming DPH, it is the regulation from the department and it has to be followed. You could also mention that
We care.
Well, I do that if it was one that I was originally involved with. It's easier because I can throw back, I told you need to follow.
Right.
But if you have an athlete who was injured, say, outside of interscholastic sports, and they're reporting on their sheet that they were injured and it's, 2 weeks ago, now does that become our headache? I would think yes.
Yes.
But it's a tough
It is.
place. But, we're in that position where we weren't part of their treatment plan to start with, and now all of a sudden, we're like,
Yep.
no, you can't play.
Yeah. I mean, the only other thing I would say about that is as culture is shifting and more places are going to have consistent policies around the requirements of graduated reentry, there will be some consistency about the need to have that. We're not there yet, but you're part of that culture change. You're helping to drive it.
Great.
Yeah, one more question. I think we're over time, and I don't want to keep you, but
Just say quickly, as a park and rec professional, you really need to think about taking up on these youth groups.
yeah,
Where they're volunteer based.
I could not agree more. I could not agree more. One last thing, Linda Brown, the resident expert, can be reached at 617-624-5432. And if you want a card, we have them.
Okay, and lunch has started down the same area we were in earlier.
Thanks, Linda.